This is Wawa, a small town in northern Ontario facing a doctor shortage.
My husband and I have been here for 26 years. I would say we're kind of accidental rural physicians in that we didn't train rurally or live rurally prior to coming here, but we came here for locum in 1996 and just really fell in love with the area and fell in love with the work. And we moved here in 98 and have been here since. We're family doctors by trade and call ourselves rural generalists to sort of encompass the work that we do. So we do a little bit of everything. We do family medicine clinic, we do emerge work, we do a little bit of hospitalist work.
Anybody who walks through the door with an illness, anyone who books in with us or presents to the emergency room, we have to figure out what to do with them.
There's meant to be 7 doctors in Wawa, but now there are only 2, leaving challenges for those remaining.
I think there's the obvious that the workload goes up at times where we don't have locum support. The admin work that sort of both at the clinic level and the hospital level is previously divided among 6 people. It's now divided among 2 people.
There's less continuity of care for patients. You know, for years, everybody had a doctor or nurse practitioner here. There are more orphan patients.
Wawa relies on locum support, temporary doctors who come to the area to fill in staffing shortages.
Biggest challenge is knowing whether or not we will have consistent locum support. When we have vacancies, we're not given full locum support after 6 months, and that, you know, it's anxiety provoking. It's difficult then to be able to, you know, to plan. And then we have a whole host of patients who don't have family doctors.
In addition to attracting locums, Wawa also needs to recruit new full-time physicians. Northern Ontario needs more than 350 more doctors. Wawa needs 5.
The less you have, the less attractive it is for a new doctor to come here. It might be sort of more daunting or intimidating to think of starting your practice here.
When you're already working short, it's actually hard to attract people.
It's a bit of a chicken and egg thing too. Like I think locums can make more money than we do, which maybe the government has to do to attract them here. But then if you make more as a locum than as a local doc, why would they pick up stakes and settle here?
For these doctors, an immediate solution is obvious and badly needed.
In our minds, it seems like pretty straightforward to just provide communities who are working short with adequate locum days to cover those vacancies.
Some funding was going to be stopping, like the measures that the government put in place for summertime surge was going to be stopping, and they've extended that temporarily, but then which has enabled us to get more locums. But then it will end again.
I think it will really encourage retention also, because speaking for myself, if we knew that we had those consistent long-term locum days for when we have vacancies, it would be super easy for Mike and I to stay indefinitely because we know we have that support.
For this couple who has been serving their community for 26 years, there's the added pressure of leaving it in good hands.
I think for Mike and I, a big piece of that is we're towards the end of our career, and you know, we really want to leave knowing that this town is going to be very well serviced and well staffed. That is the biggest challenge of being short staffed, is worrying that there's not going to be that this community is not going to be adequately staffed in terms of physicians when we leave.